Hi, Bulls. Thanks for joining us for another episode of Reach Out for Help. I'm Jasmine, a Peer Health Educator with the Center for Student Wellbeing. Joining us today is Dr. Cannon from Student Health Services. There are still a lot of questions about the flu and the flu vaccine, so Dr. Cannon is here to address some misconceptions and to provide more information. Thanks for joining us, Dr. Cannon.
Hi, Jasmine. It's great to be here with you today.
So when it comes to the flu shot, there's one big concern that's always popping up, getting the flu from the flu vaccine. Some people have said that they've gotten the flu shot and then started to feel sick, and they think the flu shot might be the cause. So how would you address that concern, Dr. Cannon?
So the flu shot is made from a dead virus, so it cannot give you the infection. However, it can trigger an immune response within your body, which sometimes can mimic very mild symptoms of the flu, such as a headache or a low-grade fever or a little body achiness. And those symptoms usually last for a day or two, but it's not the full-fledged flu. There's a different flu vaccine that's on the market that is a nasal spray vaccine, which is made from a weakened live flu virus. That vaccine also cannot give you the flu, but sometimes those side effects can be a little bit more common with that vaccine.
So college students are pretty familiar with the common cold, but a little less familiar with the flu. How do flu symptoms differ from cold symptoms, and how could you tell whether you might have one or the other?
So the symptoms of the flu usually include fever, which a lot of times is very high, over 101, or patients, if they don't have a thermometer, they just may feel very feverish, hot and cold with shaking chills. Patients with the flu will also have cough or sore throat. They may have runny nose or stuffy nose. Body aches and pains are very common with the flu, as are headaches and the feeling of fatigue or that tiredness that come along with the flu. So occasionally we'll also see vomiting or diarrhea with the flu. That can happen as well. Cold symptoms are usually much more milder than the flu. They usually are going to have just a lot of runny nose and sneezing and maybe lower grade fevers. We don't see the same high fevers that we do see with the flu. And usually patients with the colds, they don't tend to get the other serious problems that can occur that we see with the flu.
And if someone thinks they might have the flu, can they just take antibiotics to treat it?
So antibiotics are a group of medicines that are designed to treat bacterial infections. The flu is caused by a virus called influenza. We do have antiviral medications specifically designed to treat influenza virus. So there are treatments available, but they're not antibiotics. Sometimes patients with the flu may get a secondary bacterial infection, such as an ear infection or a sinus infection or a pneumonia. And in those cases, the doctor may decide to put them on an antibiotic, but it's to treat the bacterial infection that was that the body ended up developing after fighting off the flu virus. But as far as the flu, antibiotics will not work. You have to use an antiviral medication.
Another question that comes up a lot is when exactly is flu season, and when is the best time to get the flu vaccine?
So the flu season can be a little bit unpredictable. It starts in early fall and then runs throughout the winter and can last into early spring. Some years it starts a little bit later and some years it runs a little bit longer. So timing of the vaccine is important. We want to make sure that we don't give the vaccine too early because the immunity will tend to decrease over time. So you might not be fully protected for the full season. And you don't want to give it too late because it takes 2 weeks for your body to develop an immune response and to develop that immunity. So you want to make sure that you're vaccinated before the flu, you're exposed to the flu when we're at the height of the season. So ideally, we start to give the flu shot usually starting in mid-September into early October is the time that the flu shot should be. We should start administering it. But that said, we will continue to give the flu shot throughout the whole winter season. If you haven't had the flu yet and you haven't had the shot, even if it's towards the end of the season, we want to get you protected. So we'll vaccinate throughout the whole season.
So if someone got the flu shot last year, does that mean they still need to get the flu vaccine again this year?
Yes, it's important to have the flu vaccine every year, and for two reasons. One, our protection against the flu virus after vaccination tends to decrease over time. So it's important to get that booster every year so our immune system is reminded about the flu and that our protection is there, and that you're protected when you encounter the virus. And two, the virus strain that tends to circulate through the community changes every year, just very slightly. And the vaccine is adjusted every year to try to accommodate for the strains that they feel will circulate through the community. So the vaccine is actually a little bit different every year so that it offers better protection. So it's important that you get a flu vaccine every single year.
The flu shot is, of course, a great precaution, but do you have any other tips to avoid spreading or catching the flu?
Yes, it's important that, one, you avoid close contact with people that are sick so that you don't get sick. And if you are feeling sick yourself, it's important that you stay home so that you don't make other people sick. If you cough or sneeze, it's important that you cover your mouth with a tissue and then you perform hand hygiene afterwards. You have to keep those hands clean. You should be washing them or sanitizing them throughout the day, either using soap and water or a hand sanitizer. The other thing is avoiding touching your mouth, your nose, and your eyes. If you touch a surface and then you go and touch your face, any germs that you touched on that surface will be transmitted by your hand to your face, and that's how these viruses like to get into our body, is through the mucous membranes in the eyes, the nose, and the mouth. So hand washing is very important, and not touching your face. And then the last thing that is really important is to make sure that you're practicing good, healthy habits every day. You want to make sure that you're eating well and that you have good nutrition. You want to make sure that you're getting enough sleep every night, that you're trying to get some exercise, and you're reducing stress as much as possible. Those practices, healthy habits, will help to boost your immune system and keep your immune system at top shape so that you don't get sick with these viruses that are circulating every winter.
Thanks for sharing those tips with us. We've been talking about the flu shot, which leads us to the question, do student health services offer flu shots, and how much might that cost for USF students?
So starting in mid-September, we will have the flu shot available to vaccinate our USF students. And if you currently are enrolled, the cost for the flu vaccine is free of cost.
All right, that's really important information for students to know. Now, there's one other concern that I've been hearing a lot recently. COVID-19 has been a big fear these past few months. So if someone starts to feel sick, how might they tell whether they have the flu or COVID-19? Are there different symptoms to look out for? And is it possible to have both the flu and COVID-19 at the same time?
So that's a really good question. One I have to say is that we're learning more and more about COVID-19 every day, and things are constantly changing. The COVID-19 and influenza are both caused by respiratory viruses, so the symptoms are very similar. Both can cause fever and chills and achiness. The body aches and headaches are common with both. You can also get cough or shortness of breath. Patients may also have vomiting or diarrhea with these viruses, and runny nose or stuffy nose. The one thing that's unique to COVID-19 is that loss of taste or smell that some patients do experience, but not every patient will get that symptom. So it's hard to tell when a patient comes in if this is COVID-19 or if this is the influenza virus. And current research does show that it is possible for patients to have both infections, but there's a lot more that needs to be learned about that. If a patient comes into the office, we do have testing available, so we can test a patient to see if this is the flu virus or if this is the COVID-19 virus, and that will help us then to decide how to best treat that patient.
You've been sharing a lot of great information with us, Dr. Cannon, and I think there's just one last question that everyone would like to have answered. Why is it important to get the flu shot?
So the flu is a very serious illness. Patients are going to miss days of school, days of work. Many times they are hospitalized, and the flu can also cause death. This year, we are in a global pandemic with COVID-19, and getting the flu shot will not protect you against COVID-19, but however, there are many important benefits. Flu vaccines have been shown to reduce the risk of illness, hospitalizations, and death. And getting the flu this fall will be important now more so than ever, not only to reduce your risk of getting the flu, but also help to conserve some potentially scarce healthcare resources.
All right, thank you so much for joining us today, Dr. Cannon. It's been great having you.
Thank you so much. I was glad to be able to be here today.